Preparation of the recording of the tibial anterior nerve response. Stimulation at the ankle. Displacement of the electrode to look for the best response. Which appears on the screen. Same nerve at the knee. Distance between the 2 points. Now a second set of electrodes are going to be placed on the hands, on the abductor digiti minimi. First, the conduction will be tested at the wrist. Same thing on the right side. So there are 3 sets of electrodes, 2 on the hands and 1 on the foot. Searching the best point of stimulation and searching the best site of recording. That is the one which gives the highest compound muscle action potential. Ulnar nerve now at the elbow. And now above the elbow. Now placement of the bandage on the right hand. So that the joints don't move during exercise. Temperature of the skin should be measured and maintained between 32 and 34. Now recording of the response of the muscle before any exercise. Intensity slightly above maximal intensity. Now, exercise consisting of activating the muscle, that is the abductor digiti minimi, during 5 minutes. This is the long exercise. In isometric conditions. For 5 minutes, with short interruptions to avoid ischemia of the muscles. One should take care that rest and then exercise again. One should take care that the contralateral hand stay relaxed during contraction of the right hand. Rest and then exercise again. This is to avoid ischemia of the muscle. Take care of the contralateral hand, which should be relaxed. Rest and exercise again. Resistance against movement should be applied firmly. Rest, exercise again. Rest, exercise again. Tu veux que je filme pendant les 5 minutes ou je peux interrompre? Qu'est-ce que t'en penses? Temps réel alors. Rest, exercise again.
Mais en fait, comme ça fait un peu mal, je trouve qu'on n'arrive pas à sentir quel degré d'effort on met.
You can hear the sound corresponding to muscle contraction, which allows to ensure that the exercise is well made by the patient.
Dans un instant, on va arrêter, donc tu continueras bien, tu essaieras de ne pas prolonger
the end of exercise, the hand should be completely relaxed, and then a new stimulation is immediately performed, and the amplitude is compared to the amplitude before exercise. Here you can see that the amplitude hasn't changed at all. Increasing a little bit the current to be sure that the response is still obtained with supramaximal intensity. So first response is before exercise, second one is immediately after, third one is 30 seconds. And now the response will be recorded every minute. This is 1 minute post-exercise response. The site of stimulation should be checked so that to ensure that it hasn't changed, hasn't moved from one stimulation to the other, which could explain the decrease of the response for technical reasons only.
C'est combien la baisse
2 minutes. Regardez. 2 minutes post-exercice.
2 minutes post-exercise. You can see that the amplitude doesn't decrease significantly from one response to the other. Technical checking should include not moving the stimulus and checking for sweating on the hand. Sweating should be removed. This response will be regularly checked all along the following of the examination to check for a decrease which could occur lately after a few minutes. Meanwhile, preparation of stimulation of the other side, where a short exercise test will be performed. Checking of temperature, 32 degrees.
On y va pour 4 minutes. C'est de déplacer un peu pour vérifier. Ça dérange en une motivation répétitive.
J'ai déjà fait. À diète.
Ah non, 3 minutes, c'est 10 entre 3 minutes.
Non, j'avais essayé aussi.
On y va, dernier point. Oui, mais je-
This is the response 5 minutes after the end of exercise. Now, Stimulation of the left ulnar nerve is going to be performed on the left side. A bandage should be placed in the same way than before. The exercise will be the same, but only for 10 seconds. And then the response will be recorded regularly after the exercise. The response is recorded again once before short exercise will be performed. Searching for supramaximal intensity. Exercise. You can hear the sound corresponding to muscle contraction, which would last 10 seconds before a new response is recorded. End of the exercise, new stimulation, no modification of the response after the short exercise in this case. Recording of a response every 7 or 8 seconds to look for a decrease of the response, which is not the case here. This test will be performed 3 times to look for modifications from one test to the other. This is the new stimulation pre-exercise, and then exercise is performed again for the second time, short one, 10-second duration. End of exercise, stimulation immediately after exercise, and then every 7-8 seconds. Here again, no decrease of the response after exercise. There are only slight modifications of the amplitude, which are only a few percent. New reference response before exercise, and then exercise for the third time, short exercise, 10-second duration. The test should be performed 3 times. End of exercise. Recording of response immediately after exercise, not significantly modified here. And then again, every 7-8 seconds. Here again, no significant modification of the waveform and of the amplitude. Checking that the intensity of stimulation is adapted, that is supramaximal. Back to the right hand to look for a decrease of the response after the long exercise which was performed a few minutes ago, 10 minutes ago. So looking for a decrease at 10 minutes. This response will be compared to the other response obtained before. Checking the position of the stimulation to be sure to be well placed. Now, short exercise will be performed at the foot. Electrodes are on the extensor digitorum brevis, stimulation of the anterior tibial nerve. First, research of the good site of stimulation. That is the one which gives the highest compound muscle action potential. This is site of stimulation. Now, after reference response, short exercise will be performed, consisting of the raising of the toes without raising the foot itself. 10-second duration, and then relax before a new response is immediately recorded. This is the response immediately after the short exercise. Only 5% increase, no significant modification of the response after exercise.
C'est plus sensible.
Tu vas le refaire 3 fois aussi, celui-là ou une fois? Ouais. This short exercise will be performed here again 3 times to look for modifications from one test to the other. So as before, new reference response will be recorded here and then exercise performed again. Raising the toes without raising the foot. End of exercise. Stimulation again. Comparison of the response before and after exercise. No modification after exercise. In this case. Here again, responses are to ensure that the stimulus site is still the good one. Stimulus site should be regularly. Third test, reference response, size, end of exercise, response after exercise. Immediately after and then 7-8 seconds after. In case of decrease of the amplitude, the site of stimulation should be checked by moving the stimulator so that maximal amplitude is found. Now, after this short exercise, we go back to the right hand to measure the response 15 minutes after the long exercise has been performed. This is again to check for decrements occurring late after the end of the long exercise. This amplitude will be compared to the other ones obtained before the long exercise and after the long exercise. Checking the site of stimulation by moving the stimulator until the maximal response is obtained. At this time, needle electromyography should be performed. It will not be performed for real here, but just be showed. Needle electromyography will look for myotonic discharges in different muscles. First, interosseus dorsalis and tibialis anterior. The goal of this needle electromyography is to look for myotonic discharge at rest. At the end of this needle electromyography, we go back to the right hand to test again for the response 20 minutes after the end of the long exercise. The response is slightly lower, so sweat should be removed and the site of stimulation retested. The stimulator until the maximal response. This response will be tested again at 25, 30, 35, and 40 minutes after the end of the long exercise.